During the mixing steps, the manufacturing process, air bubbles are unintentionally introduced to the liquid, and removal of air is the critical step for the homogeneity of film. These film cast from arrested solution which exhibit the uneven surface and heterogeneous thickness. This is the one formulation design which is doing by the conventional film casting method, and another method is hot melt extrusion film. In this hot melt extrusion method, a blend of active pharmaceutical ingredient and other pharmaceutical ingredients are molten and then forced through an orifice. More homogeneous material in different shapes such as granules, tablets or films. Hot melt extrusion has been used for manufacture of controlled release matrix tablets, pellets and granular as well as orally disintegrated films. This is about the formulation consideration of the buccal delivery system. Another topic is last topic in mucosal drug delivery system is pharmaceutical considerations of buccal drug delivery system. Using simulated mucus field Using simulated mucus fluid and stability chamber and high performing liquid chromatography method, by using these methods we can consider the buccal delivery system. Pharmaceutical considerations. In these considerations, it requires an excessive attention to develop safe and effective buccal adhesive film. The factors influencing drug release is penetration through the buccal mucosa, organoleptic factor, and proper use of additives to improve the drug release and absorption along with the local irritation. When the site of application, the local irritation will cause and it develop the buccal film formulation. And this is about the pharmaceutical considerations. Second one, pharmacological considerations. In these considerations, the pharmacological considerations like texture of buccal mucosa, thickness of the mucous membrane, and time and effective of the salivary secretions. These are play a vital role in active pharmaceutical buccal film formulations. The active pharmaceutical ingredient stability and release should be considered before designing the active pharmaceutical buccal film. It can be done by the in vitro mucus enzymatic degradation and stability studies. In these pharmacological considerations, the active pharmaceutical ingredient absorption occurs through the transcellular route. As a lipophilic drug. Controlling and optimizing the pH can increase the drug interaction and increase the active pharmaceutical permeability also. Local residence time, concentration of the drug in mucosa, and amount of active pharmaceutical ingredient can be transported into the blood, which is responsible for the local or systemic delivery of the dosage form. The incorporation of the drug permeation can increase the enzyme inhibitors and it improve the bioavailability of the fentanyl. Fourth one, that is permeation enhancers. In permeation enhancers, the selection of proper permeation enhancers can increase the efficacy of drug. There are different permeation enhancers are available in the market. So, for proper screening technique, we have to choose the good quality, and it can be done by using high screening of permeation enhancers to analyze the content. Drug loading and entrapment efficiency studies. What is meaning by the drug loading and entrapment efficiency studies? It is done to quantity of the amount sorry it is done to amount of the active pharmaceutical ingredient present in the specific size path. High performance liquid chromatography can be used to quantify the phenylalanine. And some evaluation methods which are used to evaluate the mucoadhesive drug delivery system. They are measuring the force of attachment and in vitro residence time, and third one is gastric transist study using radio opaque markers, and fourth one is fluorescent probe method. Fifth one is thumb test. We are started with the thumb test. In this thumb test, the adhesiveness is measured by the difficulty of pulling the thumb from the adhesive as a function of the pressure. Although the contact time of the thumb test may not be conclusive, it provides useful information on peel strength of the polymer. While in the fluorescent probe method evaluation, method, the membrane lipid bilayered. The lipid membrane will be bilayered, and protein membrane will be labeled as pyrin. These cells are mixed with the mucoadhesive agents and changes in fluorescence of the spectra. These fluorescence can give the direct indication of the polymer binding and influence the polymer adhesion. While in the third method, gastric transist study using radio opaque markers evaluation method. In this method, a simple procedure involving the use of radio opaque markers. Example, barium sulfate. Barium sulfate is taken as the example of the GI transist study. The feces collection and X-ray inspection can provide the monitoring of the total gastric irritant residence time without affecting normal GI motility. In fourth method of in vitro residence time study method. In this method, the tablets are evaluated by in vivo residence time study. The disintegrating test apparatus used in this process, and the detachment of the tablet from the tissue was checked, and time of the detachment was recorded in the vivo residence time. The last evaluation method in mucosal adhesive drug delivery system is measuring the attachment force. In this process, It required entity from the application of external force, and destruction of the adhesive bond is usually under the application of shearing and tensile forces. This is about the mucosal drug delivery system evaluation method and formulations of the buccal delivery system. Thank you for listening. Please like, share and subscribe to my channel, and thanks for watching. Thanks for listening. Please like and share my channel.